Dr. John Hassett is a practicing pulmonary disease doctor in Hempstead, New York. He's been practicing medicine for 13 years at various hospitals in Nassau County, Franklin General to be one, Mercy Hospital, and Winthrop Hospital. Is affiliated with other hospitals. His information on medical history is expansive, and he is considered an expert on the 2,572-page Affordable Care Act. On today's program, Dr. Hassett will help us understand the critical mass of the Affordable Care Act, and as a critic of Obamacare, we will all be on the uptake of the upcoming changes about to be made in all of our daily lives. Welcome, Dr. Hassett.
Thank you.
Just a quick reminder about something I've heard recently, actually it's quite a while ago, when Pelosi had said, Nancy Pelosi and the Congress had said, you passed the bill just to find out what's in it because so many people had difficulty with it. That's very, very wacky.
Yeah, it is. I mean, when you look at the passage of the health care law, the Affordable Care Act was not passed by regular means whatsoever. In 2009, the House had passed a health care law, which then went to the Senate and failed. Then in the same year, the Senate started a bill. In fact, it was introduced by Charles Schumer, and he had introduced what is now the Affordable Care Act, and that had the Cornhusker kickback and the Louisiana Purchase in it, and all those other controversial aspects that occurred at that time. And then that bill went to the House, where Nancy Pelosi said, "Oh, it's close enough to what we passed. I'm going to deem it to pass." Well, that method was primarily designed for budgetary matters, where 5,000, 2,000, let's split the difference and figure in between the two. Not something that's going to be such an expansive piece of legislation as affecting a sixth of the economy, and as well as the practice of healthcare altogether by doctors. So the passage was definitely out of context, and it's still definitively unconstitutional. And I can say that because the Supreme Court Justice decision from Supreme Court Justice Roberts, he had said it was constitutional based upon the fact that it was a tax. But if you've read the Constitution, you've read the Federalist Papers, it clearly says all bills for originating taxation or originating revenue shall originate in the House.
Couldn't we have challenged it? Couldn't someone have challenged it, even the Supreme Court at that moment when he claimed that it was a tax?
Once he's already reading the statement, no. The argument should have been brought up in the process of the arguments. So that even if the administration was saying it wasn't a tax, which is why the decision was so controversial, one of the reasons, because the administration was saying, no, it's not a tax, it's not a tax, it's a penalty. But then the Supreme Court Justice said, it is a tax, therefore they can tax you on anything, which means they can tax you if you eat broccoli or don't eat broccoli, tax you if you eat lemons or don't eat lemons, but which is also a wacky idea right there. But on top of that is the fact that if somebody had challenged it, and somebody has actually, the American Association of Physicians and Surgeons actually still has a case in the circuit courts pending that is about the constitutionality of the basis, both the takings clause from the Fifth Amendment as well as from the on the fact that it didn't originate in the House. So there's still pending legislation that's out there, as well as we've also heard recently in the news.
Are you supporting that effort to create that unconstitutionality?
Absolutely. So there's still court cases out there regarding the constitutionality of the Affordable Care Act. But in addition to that, you still have the cases that we just heard recently, the Hobby Lobby case, which was a success in my mind, and now the DC Circuit Court that came out that said, look, it's basically not an issue. We are looking at this case and we're saying that there was no intent by Congress to allow the federal exchanges to pay the subsidies. So if you have a state exchange and you apply in a state exchange and you're in a state that has a state exchange, the person can receive a subsidy. But if it's a federal exchange and you're in one of the multitude of states that does not have a state exchange, those states you can't get subsidy, which means that if that decision stands, and because you have two different decisions that came out this week, if that goes up to the Supreme Court, which is what will happen next, is that if the Supreme Court backs up the DC Circuit Court, the result is that the people that have received subsidies for 2014 may wind up seeing a treble or quadruple fold increase of their premiums next year. So if they went from paying $400, they may wind up paying $1,200 next year for the same insurance.
Because they can't get the subsidies.
Because they can't get the subsidies anymore.
Isn't that a crash between the state and federal law that can't be worked out, can't be meted out?
Well, it can't be unless you open up the law again and you bring it back before Congress, which is not what people in the administration want to do right now.
It doesn't take a day and a half.
Right, and it's going to be something that brings it back to the forefront. Now, in addition to that, I first got involved with this whole thing back in March of 2008. I had been at a grand rounds at North Shore University Hospital in Hassett, where Dr. Ezekiel Manuel, I didn't know who he was at the time,
right.
But people told me, oh, he's high up in the Democrat Party. I'm like, I don't care if he's Republican, Democrat, Libertarian, whatever. But he was giving a talk about the allocation of scarce medical resources and the future of medicine. Now, he had written an article which was published in Lancet, January 2009, called The Allocation of Scarce Medical Resources. He writes in that, this is now after the 2008 election, but before the 2008 election, he's talking about the data and the research he had done and the paper that will be published, but oddly not until after the election. Because in the article itself, now it talks about, and he talked about the future of medicine. He said, basically, the only way to control costs in the country, as we talked about before, is a sixth of the economy.
Right.
To control costs in the United States, the population base is getting larger in general, the average life expectancy is getting older, and there's always new medical advances, so you need a way to allocate medical resources.
Yeah, that was one of my questions for later on. Maybe I should hit it with you now, but
sure.
With the older people, there's a huge number of people who are walking into, baby boomers, who are walking into the need for the medical insurance.
Right.
And if it's that many people walking into it, what are we walking into here?
Correct. And that was his point in one of his major points in the lectures. What are we walking into? Well, he went on to say that basically the way that we can control healthcare costs is creating a single-payer healthcare system. Now remember, this is March of 2008. He said, and we'll tell people we'll be able to provide, there are millions of Americans that don't have healthcare insurance. Tens of millions. So he said, because of that, what we'll do is we'll create a single-payer healthcare system, but Americans won't want to give up their options and choices. He said, they have 17 different brands of soda. He said, how are we going to get them to do that? Well, we'll tell them there's millions of Americans that don't have healthcare insurance. We'll be able to provide healthcare insurance for everyone if we create a single-payer system. If we, create something akin to what we're moving towards right now. And he said, when we do that, though, once we eliminate the waste, the fraud, the abuse, the duplication, once we do all that, because the population base is getting larger, because it's getting, on average, life expectancy is getting older, because of new medical advances, there's no way we can provide health care for everyone, even by doing everything we've done. Anyone who knows math knows that's a lie. So he's literally promoting in his lecture how to lie to the American people in order to get this agenda achieved. He said, so we'll need a system to allocate the resources, and that's called the complete lives system. His system, by the way, he created it. And he said, instead of triaging, which is to take the sickest first, what we'll do instead is we'll look at the age of the patient. Because people can't lie about how old they are, we have birth certificates, we know how old they are. And we'll look at how old they are, and we'll say that you can only get certain health care at certain ages. And he said, well, how will we decide that? And he said, we'll look at productivity curves.
That reeks of the possibility of what can happen for the older people
Correct.
As an issue.
Which is getting to your point. Because this, and I'll explain that in just 1 second, is that he said people between the ages of 15 and 40 are the most productive to society, for the good of society. But under the age of 15 and over the age of 40, they're less productive to society. Therefore, they should get less health care and maybe none at all. And he said the biggest hurdle we're going to have is the Hippocratic Oath. We need to get doctors to ignore what's good for their patients and do what's good for society at large, what's good for the collective. Wow. Now that's collectivism, that's socialism, that's communism, fascism, Nazism, whatever ism you want to call it, it's an ism, putting the society before the individual, forgetting the fact that society is made up of individuals. I went into medicine not to become a multimillionaire
Sure.
or to be able to drive a car with MD license plates or anything else like that.
To be a doctor.
To be a doctor, to help people.
Right.
But when you start to head down this road, it brings back the Tuskegee syphilis experiments in this country, or the medical experimentation in Nazi Germany, and the T4 project, which eventually wound up becoming the Holocaust. Initially, the T4 project was promoted to doctors as a way to help society, to help the collective. The T4 project, we know the first victim was Gerhard Herbert Kretschmar, was an infant. He was 6 months old. His parents were devout Nazis. They appealed to the chancellor. Now, the system, mind you, was created by the Weimar Republic initially, before Chancellor Hitler became the Fuhrer. And he went on to say, he said, they appealed to him and said, please help us with our child. He sent his personal physician, Dr. Carl Brandt, to investigate the child, who said the child was missing part of an arm, part of a leg, blind, and obviously idiotic. And Chancellor Hitler said, well, for the good of the child, for the good of the family, for the good of Germany, i.e. society, he ordered the death of the child, and that child was killed. Wow. That went on to the T4 project, which was expanded from that one child to claim the souls of 8,000 children and roughly 100,000 citizens
And
in general.
this is historical
Yeah, that's
context.
historical
You got
fact.
the facts going on
Yeah,
here.
so that's something that you can look up about the history of medicine, about Gerhard Herbert Kretschmar, the T4 project, and your viewers can actually read about and say,
I know the
this
average
isn't-
person doesn't know this.
Right, but you can go and you can Google it, for crying out loud.
Yeah.
Go on Google, look it up, read about it. And then when you read about it and say, wait a second, all right, so that was a truth. The Tuskegee syphilis experiments.
Right.
The Tuskegee syphilis experiment occurred in this country. It was initially started with the concept, remember, the road to hell is paved with good intentions. It was started in this country, down in Alabama, and it was Tuskegee. And basically, the experiment was designed
Prisoners?
that we didn't have, no.
No?
It was designed to look at the evolution of syphilis in the American black population. Because the Germans, oddly enough, this is before the Holocaust, but leading up to the whole eugenics concept of putting society first and looking at gene pools, they had published the evolution of syphilis in the white German population, the Caucasian German population. So the government, as well as private investors, had initially wanted to look at the evolution of syphilis in the black population of American blacks. Now, doing that, they ignored the fact that treating them as people, they said, well, half the patients we'll look at and we'll just watch them and they won't have syphilis. And the other half of the patients will have syphilis and we'll watch the evolution because we had no good treatment. At the time, it was a combination of arsenic and mercury that they were giving people as a possible treatment. Well, that sounds all well and good. We didn't have a treatment that worked. Okay, you want to follow the progression of disease. Fine, not really a problem. And they got little bits of free healthcare here and there. They sprained their leg, they got a cut, they got sutures, they got an ace bandage or a wrap because it wasn't an ace bandage at the time. And they got medical treatment for minor illnesses. Well, then came the evolution of penicillin. We knew then it was a treatment for syphilis. For primary and secondary stage syphilis could be treated and cured with penicillin. This was not given to the patients that had syphilis.
Didn't have a control group.
No, the control group had no syphilis. The treatment or the observed group had syphilis, but were given no treatment. They weren't given penicillin. Now, penicillin was back in the 1940s. We knew we had a treatment. We knew the treatment worked. It was not given. But it wasn't until the 1970s in this country, the United States of America, where finally, after a doctor who was a whistleblower, an MD, who was a whistleblower and came out and said in the 60s, and he was squashed by the CDC and the HHS, Health and Human Services, who are the same people that come about again now today. He was squashed and put down for several years till finally it was brought out, hey, this is happening. We're watching Americans die of syphilis in this group, and we're not giving treatment that we've had for literally over 30 years. I mean, talk about insanity.
When did that happen? That was in the 40s, you said?
It started in the 1920s, and it went all the way up until the 1970s. I think it was 1976 is when it finally ended.
Yeah.
And it went on through that entire time, and people just watched people die. And there were doctors, there were nurses. So even in this country, you can get medical professionals to look to abandon the Hippocratic Oath, look to abandon what's good for patients, and do what's good for a collective, for a society,
Right.
which is what's most dangerous. And that's what happened in Germany. Even as of this year, in the beginning of this year, 2014, in this country, there was a report about the EPA had been running for several years experiments on U.S. citizens, exposing them in booths, putting them in a closed booth, and exposing them to carbon monoxide and cancer-causing chemical fumes that we know are carcinogens, and using those fumes on those patients. The problem was, even if you had people, and some were children, some were elderly, some had asthma, didn't matter what lung conditions they had, they were going to do this anyway. And they did it, but the problem was not just that they did it, but the fact that they did it and they didn't inform the people. And from the Office of Inspector General office, they actually said that's a problem the EPA had because they did not inform the populace ahead of time.
If the populace had known, they wouldn't have just sat there and watched idly by.
Right. So it's a matter of what, they might have said, whoa, I don't want to be a part of a study that may kill me or give me cancer one day or may wind up hurting my lungs even further than they are already. So it can happen, it does happen, even today it happens in 2014 where a government will put a collective above an individual. As of 2012, if I remember my year right, there was a young girl from Pennsylvania who was cystic fibrosis who needed a lung transplant. She was told that the doctor said she would be a good candidate for an adult lung. And this young woman was there, and Kathleen Sebelius, Secretary of Health and Human Services, said she can't have it because she may never become productive in society, so she's not going to get it. The father wound up suing Kathleen Sebelius directly, and the judge wound up signing with him, even though there's no provision for suing the Secretary for HHS or for appealing this process in the Affordable Care Act. There's not. So he went kind of outside the means, but it was an election year, so I think the administration wanted to let it die down as much as possible and not fight it too much.
That should have been a big red flag right there.
Right, because here it is, once again, putting productivity and potential productivity and what's good for the collective above what's good for the individual. The doctors wanted to do it, the patient wanted to do it, the family wanted to do it. Now, the big question is, who's this Dr. Ezekiel Emanuel who wrote this Complete Life System?
Yeah.
He is the White House advisor on healthcare. He's the major author of the Affordable Care Act.
Oh.
So here you have an individual who, prior to the 2008 election, was talking about lying to the American people and then turning around and doing what's good for society and for the collective and ignoring giving little to no health care for people under 15 and over 40. And that's the plan
See,
of
it
the
strikes
author.
me that we, John Q. Public needs to know that there's political affiliations with some of these people in terms of their intentions. So this doctor must have been some kind of social accepting person, socialized medicine type of person.
Correct.
And he led this without having to describe any kind of connection to the administration. My problem I'm trying to get to is that as Democrats and Republicans work towards whether they're going to be able to use this program or not, and I'm taking that you prefer to repeal the law, is that the average person doesn't know. When I approach this subject to both parties, I seem to get more of a reaction against it from the conservatives or Republicans and more of a reaction toward it by liberals and Democrats. Would that be true?
I mean, I think if you haven't read the healthcare law, if you don't know the history of medicine, if you don't know the whole idea of collectivism or statism above the individual, if you don't know that concept, if you don't know what's in the law, you're more apt to actually just watch the news and say, or watch TV programs and go, oh, so-and-so said this, it must be true. So-and-so said that, it must be true. Oh, I trust this one, I trust that one.
Right.
And to some extent, you're going to have a herd mentality from people to go, I'll go with my side, or a team mentality. I'll go with my side. you'll go with your side, and just bicker about whose side is right. When in reality, both sides can be wrong on everything, or on a lot of things. And if you ever want to fix healthcare for real, you would repeal this, and you'd actually ask true doctors that are working on a regular basis treating patients. Dr. Ben Carson was a perfect example.
I'm reading his book right now. It's a great book, yeah.
And he's a very nice man. I met him once a long time ago, and he was very nice to me. But I also watched his prayer breakfast speech, and he gave a wonderful example of how you could fix the Affordable Care Act in terms of repealing it and then putting in more of a common sense solution, where people would turn around and literally have their own health savings account that would roll over year to year. And then they would be able to use that only for healthcare. They couldn't pay for their mortgage. They couldn't pay for anything else.
The poor look at the amount of money they have left budgetarily not right because they don't have extra money to put towards anything. Some people, I'm talking about the poor.
And he addressed that actually. He said people that are poor, he said, what about them? He said, they won't be able to afford to put money in for them whatsoever. Because you could do it from the time somebody was born rather than buying them a $100 savings bond. You could put money in the health savings account for one day when they need it, and it'll accrue interest and gather year after year. And for people that are older, they could stay on Medicare and the traditional type of systems. And if people wanted to buy into a private health insurance plan with their health care dollars, they could.
I mean, in America, we capitalists or not?
Right. Well, that's what it should be. And ideally, we should be capitalists because we've seen how socialism fails. You can look at the news in Venezuela and realize how it's failing all over the place.
Well, what society that you know of where socialism has really thrived?
No place where it's thrived. It kind of meanders. Because you can't bring everyone up to a great level, you can only bring everyone down to a lesser level.
Right.
There's no way to elevate everyone that I'm aware of.
Right. Well, it just eliminates incentive. There's a lot of incentive loss in the socialism.
Correct. And there's also, there's incentive loss. There's incentive to succeed. There's incentive to not fail as well. So if you didn't want to fail, if you wanted something better, you'd have an incentive to succeed, an incentive to go further. So by using Dr. Carson's plan, for example, you could turn around and say, wait a second, you submit this, and what about people that are too poor that want that type of plan? Well, we already give healthcare dollars to that. Potentially the government could subsidize them along those lines, but go into the health savings account. But the point being that he was making, however you wanted to hash out the meat and potatoes even further, but the point he was trying to make is that when you have skin in the game It doesn't matter if you're the poorest of the poor, the richest of the rich. If you know that drug X to treat your cholesterol is going to cost you $500 a month, and you know that drug Y is going to cost you $10 a month, and you say, well, you're going to get a little bit better effect with drug X than drug Y, you might go with the cheaper of the two drugs, saying, I'd rather save that $490 every month for maybe I'm going to need a triple bypass one day, you know, something that you might want to save that money up for. Or you might say, you know what, I want the better cholesterol med to avoid the triple bypass in the first place. But you would then have the freedom, the individual freedom and liberty, which I think is about the individual and about freedom and liberty rather than a collectivist society
it takes away
approach.
choice. There's an imbalance of how you treat someone then. It takes away choice.
Right. And in fact, taking away choice is a perfect segue to the fact that as of January this year, any doctor that participates in the exchanges or in Medicare technically may not have a choice in the practice of medicine anymore.
Don't tell me they have a penalizing system going on.
Correct. According to the healthcare law, the Secretary for Health and Human Services, which I don't think the changeover has gone over completely from Kathleen Sebelius yet, but the Secretary for Health and Human Services can dictate basically how healthcare is run. So to put it in plain terms, if you came into my office and I took, let's say, the exchange plan X, and you came into my office and you had exchange plan X and I took that insurance, I would enter a diagnosis into the computer when they finally have everything squared away, which they don't. But I would enter in the computer. It should go real live time to Washington disease database, which can be updated fairly regularly in terms of how to treat you. And we know by the author's stance, how to treat you will be based upon your age. And they'll say, well, look, Chris, you're a nice guy and all, but you broke your hip. I'm sorry, I'm giving you a broken hip here.
Yeah.
But you broke your hip and you're over the age of 40. It says right here, instead of sending you to an orthopedic surgeon for a hip replacement, I should instead send you home and give you Advil and tell you to try and bed rest for the next few months until maybe it heals on its own. Yeah, exactly. And that's basically it. So it takes away the choices between you and I as the doctor and the patient should have only between us without the government involvement.
That's the mindset of the death panels we keep hearing about.
Correct. In fact, there are death panels, although they're not called death panels. The Independent Payment Advisory Board was established in, I think it was Stimulus 1. And in the Stimulus 1 bill, when it had been established, the Independent Payment Advisory Board is supposed to be made up of individuals that the president appoints to this board that'll make all the healthcare decision recommendations to the Secretary of Health and Human Services, along with the U.S. Services Preventative Task Force, which does exist. Now, the IPAB, nobody's been appointed yet that's been approved for the IPAB yet. So it still sits unrecognized, which just basically defers back to the Secretary of Health and Human Services. And even if you had it in place, it gets a kind of oversight because it goes before a House Congressional Subcommittee that can make their recommendations based upon the IPAB recommendations, and then that then goes to the Secretary of Health and Human Services to decide what he or she wants to do anyway. So in the end, it always goes back for the Secretary of Health and Human Services to make those dictates from an unelected bureaucrat who will decide healthcare decision making. So as a doctor,
your power's being removed as a doctor.
My power's being removed.
And here you're the on-hands person with the patient, and
Correct.
You're losing your power.
Right, and I'll be told, I must do this for you. So go back to my broken hip example with you. If I decide then at that point in time I won't listen to the government, I'll say, that's insane. The man's got a broken hip, he needs a hip replacement. And I say, go to the orthopedic surgeon. I've now violated a federal law, and it says in the law will be penalized. Well, a doctor went before a House Congressional Subcommittee in 2010, said, what's the penalty? Because it doesn't say it in the law. And it says, you'll be fined $100,000 and up to 6 months in jail. Now, whether or not that winds up remaining to be the case, I don't know.
It's scary enough to have started at that
number. The fact that there's any penalty.
Sure.
In the first place. Now, if I say, look, you know what, Chris, I like you, you're a good guy, but
you're
the
toast.
Computer tells me you're toast. Go home, take the Tylenol, take the Advil, and lay in bed and hope that it heals one day or some year.
So who's this really helping? The patients aren't getting help. The doctors could be intentionally in danger of being penalized for not choosing the right choice.
And if I do this and I tell you to do the wrong thing, I'm now liable for medical malpractice as well. Not only have I violated the Hippocratic Oath, not only have I violated my ethics, I've gone against my soul and my belief system. I now am subject to medical malpractice suits because I've told you bad medical advice. Even though the government's telling me what to do, I still have the obligation to
takes away the soul of your profession.
Correct. but it also puts
We have about
doctors...
4 minutes left. I want you to round up as best as you can in the next 4 minutes or so what we can do with this.
You got it. What we can do, but
What can we do?
To finish that quickly,
Yeah.
just a thought,
Yeah.
is that it not only takes away my options and my choices, it also puts any doctor who's willing to give up their Hippocratic Oath and willing to go along with the system, it puts them in a no-win situation.
Compromising
as well.
their integrity.
Compromise their integrity and face lawsuits for medical malpractice, or don't compromise their integrity and go to jail or face penalties and fines. So it's a no-win situation. What do you do in terms of that? Well, the viewers, they should get active. They should read more about it. They should learn about it. Look up the stuff I've talked about, the Tuskegee syphilis experiments. Look up about the APA. Look up about the T4 project. Read about putting society before an individual and forgetting that the individuals make up the society. Read, learn about those facts. If you can't read the whole law, it's fine. You know, you do the best you can with what you can. But then get active, get out there, learn more about it, and then query your politicians about it. Query about, it's an election year, as you mentioned before. Talk to those politicians and say, hey, wait a second. You know, what's your stance? If you get into office in the House, how are you going to vote if there's a vote to repeal the Affordable Care Act and put it in a better solution, like Dr. Carson's plan? Are they going to say, no, I'm not going to do it? Ask your senators if your state senator is up, or not your state senator, U.S. senator is up from the state, and say, how are you going to vote? And get in that program.
My fear is that in some elections, and I think the last one may have been this way, the uninformed voter came to the voting booth. And the uninformed voter is not going to be able to get a lot of things you're talking about now, I don't think. But what you're suggesting, to have to go to these websites and find these things out, is the first day of the new day of their lives.
Correct.
And that's what has to happen.
Right, it does have to happen. And as I talk to some of my liberal friends who are teachers, and they're all up in arms about Common Core, which we're not here to talk about.
Right.
And I'll talk to them about that. I basically have put the parallel to Obamacare to teachers. Obamacare to doctors is what Common Core is to teachers. It's taking away how you do what you're supposed to do and how you put the student first in terms of Common Core, how you put the patient first in terms of medicine. And it takes away that trust and that integrity and puts an unelected bureaucrat in charge of the practice of medicine.
The notion I have is we're slipping away. We're slipping away from what America, in my opinion, I think a lot of people would agree with me, is probably the greatest nation that ever was. And our foundations are capitalist. And we're losing our ability to make our own choices by going in the directions that the Obamacare or the Affordable Care Act is going, and also Common Core, as you suggested. Yeah, I mean, it's all about taking away the people who were trained to do what they were doing, taking away their power.
Yes, and if you really want to get a very simplified but a great cartoon that I've showed my kids, and I'll show anyone under the sun, is something called Make Mine Freedom. It was made back in the 50s, if I remember right, by the Harding College. And it's on YouTube. I mean, so you can just type in Make Mine Freedom cartoon. It's a just to explain that concept of freedom and liberty.
What's it called? I'm going to go to
Make Mine Freedom.
Okay.
And I forget what year exactly it came out, 47 or 48, something like that. And it was 1940, 47 or 48. And it's a wonderful cartoon to explain the concepts of freedom and liberty. And I believe in individual freedom and liberty. People always tout freedom, liberty, choice. Well, here's a case where your freedom and liberty and choices of healthcare are being taken away from you, and you don't even know it. You'll discover it when you need something and you get denied, or you'll discover it when it now costs you 3 or 4 times as much as it did in the past.
Dr. Hassett is going to be speaking on August 14th at 2 p.m. at the Plainview Old Bethpage Library Auditorium on Old Country Road in Plainview. I want to make sure I mention that. Thank you very much, Dr. Hassett.
Thanks, Pat.
Our power is being taken away from us. I'm very concerned about how that's going. Societal and political trends are rapidly breaking down the family that once was the cornerstone of our American existence, and this is also breaking down the American capitalist threshold. Please watch us every single week. My name is Chris DiMaggio. Thank you for watching FIT TV, and we'll see you again next week.